Yo, what's going on, everybody? This is your boy, Hanz Fequiere, the healthcare CEO. This is episode 16 in English, episode 16 in Gujarati, or whatever that is, and episode 6 says in Creole. That is right. I got a special guest from India, my man, Dr. Anand Mehta, the guy, stand-up family practice. Let's go!
Hello.
I got a new engineer here, so she doesn't know the clap. Let's go!
Thank you. Appreciate it. Appreciate
Dr. Anand.
Yes, sir.
What up, my guy?
How good, man? I'm good, Hans. How are you, man?
I am
good
blessed.
to see you
I'm
again.
Blessed. Thank you. I'm going to tell everybody where we're from, but on every episode, we got to lay down a couple of house rules, right? And the house rules are that we ask all our guests to leave their keys at the door. There is no gatekeeping on the Healthcare CEO podcast. Are you cool with that?
I'm cool with that.
Definitely. And then the other house rule is you got to leave some breadcrumbs, right? We want everybody who watches this episode, especially with you in today's climate, that you're going to leave breadcrumbs. You're going to leave the blueprint on how somebody could get to know you,
Sure,
become the next Dr. Anand, or start their own family practice. But most importantly, I think really is how do they reach you because of all the things that are happening in today's political climate, right? And healthcare industry.
Absolutely.
So again, tell me a little bit about yourself. I met Dr. Anand at the Goldman Sachs cohort, right?
Yep.
And one thing about Dr. Anand
222, by the way. 222.
222. Oh, last but not least, other housekeeping rule is I forgot when you yelled out 222. Just like, we were supposed to say something, but either way, we'll talk about. Healthcare CEO, 90% information, 10% motivation. All right?
You.
So we know everybody has a backstory, and we know we want to hear a little bit about the backstory. But if you lost your dog and stuff like that, I'm not really interested in that too much.
Okay.
But I give you 10 minutes, 10% of the show to just talk about that and make you more relatable to our audience. All right.
Okay.
So we met at Goldman Sachs.
Yes. Virtually. We actually met virtually, right?
Right.
Online when the Goldman Sachs course started. That was back last year. Kind of around this time, actually, right? Mm-hmm. And I remember I was trying to connect to see who was in my area, and Hans, you were in Atlanta, and I was in Atlanta, and so it was kind of good that we had a connection just being in the same territory together because it was a virtual cohort that was all across the country. And so we got people from many different states. So just to have the ability to see someone in-house was awesome.
Yeah.
I remember you came to my open house around the same time.
That's right.
You know, and that was a great time because you and Chef came by. You brought me one of your amazing grilled cheese sandwiches, right? From Ann Cheese, and it was amazing. And, it shows the support we have for each other, not only in the professional world, but also just as friends.
Yeah.
Obviously we've been able to go to New York City and graduate together. And I think that speaks for the accomplishment we both did.
Yeah. Goldman Sachs taught us a lot, man. And just knowing you, it is so special that you have your own family practice.
That's right.
Which is dope. So you guys pay attention to this.
Yeah.
And I know I don't like doing a lot of promos and plugs, but I want to know while I go, and we discuss everything, feel free to tell people, like, where's your practice located?
Yeah, it's in East Cobb, Marietta. It's 3775 Roswell Road, Suite 150. It's right in the heart of East Cobb. We actually just moved into a new office space about a little over a year ago, and it's a beautiful space. And
it's
as
called
you
what?
Huh?
It's called what? What is it
It's
called?
called stand-up family medicine.
Why stand-up family medicine? I want to know.
Well, stand-up family medicine comes from a lot of different reasons. Stand-up family medicine is because, one, I perform stand-up comedy.
Okay, that's dope. That's
doctor
dope.
that does stand-up comedy. So I wanted the name to reflect who I am.
You hate when people go, oh, you do stand-up? Tell me a joke.
Yeah, I hate when I get put on the spot like that. I'll tell you that.
I'm not asking. I'm just saying. Yeah.
But the other meaning behind it is I feel like stand-up has a voice, and it's standing up for physicians. I'm standing up for better patient care. I'm standing up for better healthcare altogether. You know what I mean? Yeah. And so stand-up family medicine has a sort of a bigger background than just stand-up comedy, even though that's kind of what my model and who I am, and it's a reflection of my personality.
Yeah, that's dope. So let me ask you this. So you got your own family practice, which we're going to get to, right? Yeah. But that wasn't where you started. You didn't just come out of, medical school. And by the way, I am a doctor for all TV purposes. I have my lab coat, stethoscope. I'm official.
Okay.
All right, we'll figure it out. I'm going to diagnose your issues.
You can take my call, man. No problem. You can take my call anytime.
Where did it start? Not the practice, but where did you start? I know people have to do their residency, but you started working for corporate America.
Yes, yeah. So, like most doctors in America, we go to residency. I graduated residency from Hunterdon Medical Center in New Jersey. I took a position with them right out of residency. I was being paid peanuts and kind of introduced into the corporate world of medicine and what hospital medicine was like. Did that for about 4 years, and I learned a lot about being just a number. You know what I mean? Physicians and patients get relationships, and those relationships you form mean something, and we're people and so patients. And I think that you need time with patients in order to do good medicine. I always believed in that. In hospital medicine, it's always about money. Like most corporations, we have to make money, and I understand that. But what that does is it affects the relationship you have with patients. And so the more patients you have to see generates more income, not only for the hospital, but also for your salary. And it gets you get warped into a way of doing medicine that's different from what you're supposed to do and how it's supposed to be done. And so you just have to see more and more patients. And on the patient side, that's less time with the doctor. And ultimately, that's just less information that we're giving to each other. And I think that it limits healthcare the way it's supposed to be. I was in there from New Jersey. I went to Atlanta. I started with Wellstar, and I worked for Wellstar for about 5 years. And then I took a job with Walmart Health to try to revolutionize healthcare. I was the first medical director for Walmart Health.
Oh, that's awesome.
They made the first location in Dallas, Georgia, and it was a very big learning experience. I did it because I wanted to give healthcare to more people and make it affordable. The problem, though, is with any corporation.
How did you do that, though? Because you said you got into Walmart to make it more affordable, so you could dictate the pricing?
So Walmart wanted to revolutionize healthcare. They wanted to do patient visits for $40 a visit initially. And I remember I was like, there's no money in that. And they ultimately found out that there was no money in that, and primary care is hard. You know what I mean? But by making it $40 and knowing that Walmart you're going to have all types of people going into Walmart, you're going to have a lot of people who never got health care. And those are really sick people, And so for $40 a visit, they're coming from no real healthcare background. And you're treating them right from the start, right from the scratch. And so they had a good principle in what they were trying to do, but there's just no money in $40, and there's just a lot of sick people. And they didn't just have the right people to take care of them. And it just basically became a model that was not successful. And they actually ended up closing last year.
Wow. But you got that experience. And so I love that, because this is part of your journey. And God, I think, always puts us on a journey. But I always tell people there's no such thing as a bad experience, right? Because you got to be able to take something from it.
Yes.
And there's no way you could go through any experience, like good or bad, and just say, I didn't learn anything. If you learned something, it wasn't a bad experience. Maybe the result wasn't favorable, right?
Right, of course.
But you're like, hey, I could take this, and now it taught you not to do this, right? They say you can learn as much from
it was a great way to learn how to do primary care without emptying my wallet to try to do it. You know what I mean? So it was a great learning experience and understanding, look, this is a good way to get people healthcare that they needed, but it wasn't done right. You know, and it didn't have my sauce behind it. And one thing I'll tell you about Walmart that kind of came behind the name stand-up is when I started with Walmart, they made me take all my stand-up videos down, all my YouTube content, all the stuff that kind of was my personality, because that just wasn't the image that they wanted. And I can understand that. And of course I did it because I needed the job. But when I left, I automatically knew I wanted to call it stand-up because that's who I am. You know what I mean? And if you can't be the personality and who you are and practice the way you want, then you're not really doing medicine for the reasons you wanted to do it, and you fall out of love with it. Yeah. You know?
Well, I credit you and I credit Walmart, to be honest with you, because just thinking about $1 billion company, you didn't even have to think, how do we help other people?
Right.
And for them to even think that.
Right.
I mean, this is not a plug. You know, we probably shouldn't even say their name, but since we did, I'm just thinking about major companies don't think about how we can help. And that was huge for them to even go, hey, we want to help people that don't really have it.
Well, I mean, it's a huge industry that's really empty. I mean, it's a multi-billion-dollar industry healthcare. that just doesn't have a good answer right now. And you know, with the state of the government now and where healthcare premiums are going to, I think we're not making the system better. We're making it worse. So there has to be a solution to this chaos.
And I think you're part of the solution. So one of the reasons you're here is not just because we're cohort brothers or whatever, but you really it's crazy how you can plant a seed and not even realize that the harvest of the world is perfect.
Yeah.
In alignment
Yeah.
with what you planted years ago.
Yeah.
Right. And it's like, oh, I'm growing at the time that this guy's in office and cutting everything. Right.
Yeah.
So it sucks that it's like bittersweet, but you're the solution. I always tell people that business is not as hard as people make it seem, right? You find a need, provide the answer, the service or product. Right. And it's really that's it. But now that, they're trying to government shutdown definitely is one of the reasons is, Affordable Care Act. They want to do away with all that.
That's right.
But you have a concept at Stand Up.
Yep.
Right?
Yep.
Explain that to people.
Sure.
And what made you come up with that outside of the Walmart thing?
So direct primary care is the kind of practice that I had. Direct primary care is basically direct relationship, direct financial transaction, direct direct community between you and the patient, right? So patient does not use insurance in my practice. The patient pays a monthly fee. My fee is $129 for adults, $59 for children, and $149 for anyone over 65.
So it's how much is it?
It's $59 for children.
Hold on, 59. Let's say somebody is that 2 kids or one?
That's one kid, one child.
59. So let's say I have one child, and then you have, how much is it for?
Adults is $129.
129.
Yep.
Times, and that's, plus 59.
Right. So let me cut it. A family of 4 is $300 a month.
And what does that give you access to?
Yeah.
And what does that limit you to? Because I'm going to tell you right now, one question.
Sure.
Is that income based?
No.
That's not income based.
That does not matter what income
So I'm going to set you up with somebody, our next, I'm not going to say guest, whatever, I kind of gave it away.
Yeah.
They're paying $3,300 a month because of their income.
Right.
And they can come to you and spend an extra 30 minutes in traffic, but save $3,000.
Yeah, probably.
Right?
Yeah, so I want to be very clear. I'm not insurance. You know what I mean? I'm primary care, which is 90% of healthcare if you think about it, right? Now, I tell people you should always have some type of catastrophic insurance, but those premiums that she's paying are going to be far less for a high deductible plan than what she probably has,
Explain.
So think about $300 a month for a family of 4, right? Yeah. Which is about $3,600 a year for your family to have full primary care coverage. That's no copays, that's no deductibles. That is 1 hour long visits with me. That is after hours access. That includes virtual visits. That includes phone calls. So they have my number with them at any time. So if they're in Florida and they went to the beach and their kid got stung by a jellyfish, they can call me. I can set up a virtual call. I can send medicine to them in Florida. They don't have to go to an urgent care. They don't have to go to an emergency room. All the chronic conditions with primary care, your high blood pressure, your diabetes, your cholesterol, your back issues, your psychiatric care, you name it, right? We take care of it, right? And not only is it in and out the door, it's half an hour for acute things and 1 hour for chronic issues, right? Along with your physical. So we spend the time we need to get your health care better, okay? So you have my plan at $3,600 for your family, and then I would tell them that they should get a high deductible plan to add with it. Now, high deductible premiums, it's high deductible insurance usually has lower premiums monthly, right? However, if they said, well, I don't like those premiums, there are other systems like cash, what they call cash sharing programs, things like Sedera, Zion, Liberty Health Share. Those are not insurance as well, but those are ways to have a catastrophic save me plan along with my plan.
Say those things again. What are those?
Yeah, Sedera, Zion, Liberty Health Share. I mean, if you type in health share programs in Google, you'll find a number of them, and I can't even name them. I just say Sedera and Zion because that's a very common cash sharing program that works with DPC, which is what I do, direct primary care.
What is a cash sharing program?
So cash sharing program means if you go to the hospital and say, I have chest pain, okay, that you were saying you're a self-pay patient. Now, every time you have anything linked to that chest pain moving forward, Sedera, Zion, these kind of programs will say you pay them whatever your deductible is. And you can pick a $500 deductible all the way to $5,000 deductible, which will then kind of dictate what premium you pay per month. Okay. And that is the money that you're paying for your bill. And then you send them the bill, right? They negotiate with the hospital and they pay the rest of it. And everything linked to chest pain. So that meeting with the cardiologist, the imaging, the angiogram, the cath, all of the procedures, everything linked to that diagnosis is paid. Right?
Yeah.
Now, it's not insurance. Okay. So they're like, well, why doesn't everyone do that? Well, the disadvantage is if you're seeing a lot of specialists, every different issue you have
is a different deductible.
Is a different issue. And that's a deductible that you have to pay. So if I saw an endocrinologist, I'm paying that deductible to him. If I'm seeing a cardiologist, I'm saying that deductible. So it doesn't cover everything.
Yeah.
Right? High deductible premiums are insurance plans that have a $7,000 to $10,000 deductible, which means if you have a oh shit moment, right? Car accident, a heart attack, something that brings you into the hospital that requires a stay, your deductible is going to be $10,000. And that's going to come out of pocket. And that's a pretty big chunk for a lot of people, obviously, right? So those plans are, but on the other end of it, if you have a primary doctor and you're checking routinely with your health, you're limiting those kind of consequences to happen, right?
Definitely.
There's a lot of people in this country that don't have health care. And there's a lot of people who don't get primary care because it's just not sustainable or affordable, right? But if we have a model like mine, and it's just not my practice, there's direct primary care all over this country. There's direct primary care in Alaska. There's direct primary care in California. You name it. You have to Google a direct primary care office near me. You put your zip code in, you'll find someone, right? And so when I started, there was maybe 1,000 practices going around. That's 5 years ago. There's over 2,500, and they continue to grow because doctors want independence and doctors want to practice medicine the way it should be, right? The other option, there is something called Atlas Direct. Atlas Direct is sort of like an Aflac plan in where you have $100,000 as far as your personal spending, meaning they will cover the cost of, they'll give you a check for, let's say, a colonoscopy for $1,500. And that check will cover the self-pay rate for procedures like colonoscopies or a specialist or an inpatient admission, you name it. But it's limited to basically $100,000 per individual. So these are, and there continue to be more and more things that are growing to kind of help aid direct primary care in the areas that it can't cover, right? And it does make healthcare more affordable, less than $3,500 or $4,000 a month, which is what a lot of employers and self-pay individuals or self-employed individuals are doing for themselves, right? It's ridiculous, and unfortunately, these currently what the government is shut down is there's healthcare premiums that are continuing to rise, and they're supposed to raise something crazy like 20%
by the end of this year,
right?
Yeah.
And how are people going to really afford healthcare at that point?
I don't think they will be able to.
So what does that do to our system? That makes emergency rooms, because it's the only place they can go, flooded with people with all types of chronic conditions, and maybe not even chronic conditions, things like a urinary tract infection or a sore throat. You can't keep up with this kind of model and expect people to get good healthcare and expect hospitals not to suffer. And even if they do go to the emergency room, who's paying? Who's paying the bill?
Yeah.
Right?
These hospitals don't have it. A lot of them are dependent on Medicaid and all that.
Right.
And you cut Medicaid.
But you're cutting those things too, right? Yeah. So healthcare debt is going to increase for not only these individuals, but these hospitals aren't going to get paid either.
Close down.
So we got a crisis.
Yeah.
You know what I mean? And one solution is practices like us to help that crisis and to help these people, at least in these kind of areas of primary care, to get better healthcare where they need it.
Yeah, definitely. So let me ask you this. I mean, that was... I love the information, right? That is just, you got me thinking. So sometimes I might fade off into the sunset, just like, man, because I'm not going to say I'm big into politics, and I don't like none of my episodes being about politics, but it's so relevant to what you're doing now.
Right.
So ever since this administration came in office, do you see a spike in your patient membership?
You know, the turnaround from what's happening now hasn't just happened because we're in it.
Yeah.
You know what I mean? And I think the more, when I started direct primary care in East Cobb, Marietta, where I practice, it wasn't heard of. I was the first practice who really did.
When'd you start?
In 2020, October 2020. So we're on our 5-year anniversary.
Nice.
Right?
Congrats.
Appreciate it. And so, now a lot more people, when I say direct primary care, understand what that term means and what the practice and how it is.
DPC people.
Yeah, DPC for life. And so, it's the word and the communication and getting people knowledgeable about this and these models is what's important, right? And once that happens, yes, I do think that there's going to be a lot more practices. And I think, our practices are going to need a lot more doctors to make it sustainable, because I think supply and demand is a big thing. I think we have to supply more doctors in these practices in order to cover the demand of the population that needs it, which is going to be essentially huge now.
So let me ask you this. Can I start a DPC?
Can you start a DPC? Well, a DPC usually is started by doctors. Now, there are corporations that are starting to try to launch direct primary care, private equity groups that are trying to get into the space, because healthcare is obviously just
It's not going nowhere. So let's say like 2000. No.
You trying to buy my practice now?
I am not going to buy your practice. And you started in 2000.
Yeah, 2020.
So 2020. So I come to you at 2018.
Yeah.
And I'm like, yo, doc, I got this idea.
Yep.
Somebody's doing DPC in Jersey.
Yep.
I got the money.
Yep.
I need a doctor.
Yeah.
Can I start one?
Sure. You can start any business like this, but you're going to need a doctor to run it. You know what I mean?
Of course.
Now, I came into the space not knowing anything about business. Another reason why I took that Goldman Sachs course to get better at what I do, because doctors are not businessmen. I wish in medical school they taught us business.
Yeah.
But they don't teach you business for a reason, because they want you to go in the hospital world. They want to kind of mold that yellow brick road into that kind of
cheap. Hurdle.
Right. And so we get kind of pushed in a career that we don't know anything else other to do.
I will tell you this. When I realized my value in business, a friend of mine, Dr. Evans, he's the medical director for Piedmont Henry.
Yeah.
And then my friend, attorney guy. And it was like in the same week. So I felt like God was trying to tell me something. Mm-hmm. Within the same week, they don't know each other, but they was like, hey, man, I got this business thing I want to run by you.
Sure.
I'm like, yo, you're a doctor. I'm not putting... He's like, bro, I do ER. I don't know shit about business.
I'm
like,
that's right.
And then the other guy's like, man, I do car accidents. Yeah. I don't know. I want to talk to you. And I was like, okay, cool. I've been an entrepreneur for 20-something years.
Yeah.
I got it. But we are trained, and I was trained in school, and like doctors are like the pinnacle. But y'all really ain't shit outside of the hospital.
Outside of 12 years of school, it ain't shit.
No, I'm just kidding. I was just kidding. But you guys know very much a lot, but you practice the medicine.
Yeah.
And then you're like, hey, let me take on again. You went to Goldman Sachs to increase your knowledge. So it just says a lot about you as far as, hey, your why is so much bigger than yourself.
Yeah.
You know what I mean? Which is amazing. That's what I love about it. It's like you could have said, hey, I just want a big job, pay me a lot of money in this system, which a lot of doctors do, right?
A lot, basically most of them, yeah.
And we're just a number. Right. And you give us a prescription, we get out, next patient for the rest of your lives.
Yep. And see more and see more and see more until, otherwise you don't get paid.
Where'd you get that why from?
Where'd I get the what why?
The why. Like your why is I want to do this to help.
Yeah. My why is getting tired of being on a hamster wheel working for somebody else. A lot of the administrators, a lot of the people at the higher up levels in the hospitals, in the insurance world, they're making millions, if not billions of dollars. Look at these insurance companies like United and Aetna. And those people don't take pay cuts. They get pay raises, right? But they're not doing the work. People like me and my other physicians and my colleagues and the specialists, they're doing the work, right? Yeah. But they're not getting paid more. They're getting paid less. The reimbursements from these insurance companies continue to go down. You have Medicaid and Medicare.
They're getting gutted.
They don't even do it.
Yeah.
And so when you are a private physician trying to run a private practice, it's not sustainable. Staff costs more. Supplies cost more. The lease, the building you're in, that costs more. And so when prices on everything around you are going up and you're getting paid less from the work that you do, it's a one-way, dead end.
So you're like, I might as well just start my own.
So when I start my business and I'm getting paid in a cash model and I take insurance and I shove it out the way, then I know I'm getting paid directly, right? I know that the patient is getting what they need because I don't have to see 30 people a day. My office schedule is 6 to 8 patients a day, which gives me time. Nice. Right? But in the old world, I was seeing 15, 20, 25, 30. And that's what, unfortunately, doctors don't understand. Every corporate job starts nice.
Yeah.
It's a great relationship because you're getting paid guaranteed money and you're not set to you're not told that you have to see so many people. But that time runs out, you know, and what they learn and what I learned is as those years that you work for somebody, they expect more, they demand more because they want to get paid.
Yeah.
Right. And so 10 patients a day turns into 15, 15 a day turns into 20, 20 turn. And what does that mean? That means that patient and that relationship I had at the beginning changes because they have less time with me.
Yeah.
You know, and a lot of people can understand if you're a patient, you go in the door and it's maybe 5-10 minutes with the doctor. You get some scripts, you know, handed to you. You go to the pharmacy. You don't even know what you're taking. You don't know what they're for.
Yeah.
You didn't get any health education at that visit. You just got told you have a diagnosis and this is what you got to do. But you understand nothing about how to do or treat that disease on your own.
Yeah. And how to get off the medication.
Right.
Most importantly.
And then if you need a follow-up visit that costs money.
Yeah.
Like for your blood pressure recheck or your diabetes recheck or your thyroid follow-up, you don't go because you don't have the money to go for another visit.
Yeah.
So what does that do? That leads to bad consequences, right? But if you came in and I said, listen, you can do this better with your lifestyle. You can change how you are without medicine necessarily. This is how the disease works. And you educate yourself and I help educate you, you get better outcomes, right?
I'm switching. I'm coming to you.
Yeah.
So I'm done.
That was easy.
Screw my doctor.
You know?
No, I'm just kidding. She's nice.
But I think that's where the why came from. The why is, there's an Uber driver that got recommended or
Is
referred.
this part of the 10% of motivational?
This is.
Tell me we got 10 minutes left.
And, the Uber driver came from a referral from another patient and bad diabetic, African-American gentleman in his 50s.
Why you gotta be African-American?
I'm just classifying. It's just the way it was, man. It was just that patient.
Okay, all right.
But he had no idea about his diabetes, no idea he even had it and was really sick, you know? And in one visit, we gave him an hour and a half of education about his disease. We gave him medicine walking out the door that cost $2 to $3 for a 90-day supply. And we educated him on how he can do better. And that man's diabetes is well controlled now because he had an A1C of 13 and that A1C dropped to 7 when he saw me.
Did you just say who?
I said, "Ooh."
Oof.
Yeah.
See, my engineer knows about
But he
diabetes,
was motivated. And
You're diabetic? All right, so we got you a new patient.
Yeah.
Dr.
I saw her sensor on her. I didn't want to shout her
that's
out.
what
But
doctors do. They're like, oh, new patient.
I start writing in my checklist. I was like,
Walmart just looking at people with sensors. Hey, here's my number.
But yeah, but that's the motivation. That's the encouragement. I'm helping people get better, and that man's life has changed now.
All right, so I gotta pause you real quick. So, I want everybody to know you're our new engineer, at least hopefully, right? You want to introduce yourself?
Yeah.
You gonna do it from there? Is there a mic back there or something? Yeah, you gotta,
come on up.
That's what happens. See, people that got diabetes, they don't want to get up and walk. I'm just kidding.
I'm not used to coming in.
All right, here, share the mic with Dr. Anand. You want to do a quick physical on her? Like, we got the chair. We can make this happen.
This is HIPAA protected.
Oh, my bad. You're right.
HIPAA protected.
So,
I have nothing to do with this.
This is our new engineer. Can you introduce yourself?
Let me get into the camera.
See,
hey, y'all. My name's Melanie Hancock. I'm assisting.
Get the chair, chef. Get the chair for it. It's right there. Yeah. Because our second guest is going to come with a second chair anyways. So we're fine.
I got a stool right here.
Oh, there we go. Dr. Stool.
Oh, gosh.
Let's go.
We're making
We're making
things happen.
Very unorthodox.
Healthcare CEO, we ad-lib everything.
Okay. It's nice to be on your show. Yes, I'm supposed to be behind the camera. I'm Melanie Hancock, yes, and I am assisting the crew with producing this particular episode. Well, next episode as well.
You're on a trial
episode
basis.
16.
Episode 16,
Yes. So my question is, thank you for coming. And Melanie, you definitely came in at the last minute. Yes. But now you've listened to the podcast, have you?
Yeah.
All right. So have you noticed, just be honest, is there a difference with his approach than what you're familiar with?
So that's a good question. I actually and it's funny because I have a doctor. She's in Midtown. I live in Stockbridge. If you guys aren't aware, if you're watching, somewhere not in Atlanta, if you get to Midtown, it's a pain to get there. But also, in addition, it's not really. I have to pay a deductible. It's a hard time getting hold of my doctor as an endocrinologist. It's like a hard time. The last time I seen her was at the beginning of this year. I tried to get an appointment. Midtown traffic. I was late. Couldn't reschedule for months later. later, I have an appointment in Spivey, like this whole story anyways. She comes to a different branch. But anyways, long story short, she prescribed me some medicine, couldn't do a follow-up immediately because it's just, she's so packed. She's so packed and I forgot the insurance. I think I'm under Cigna.
Okay.
Yeah, I'm under
We're
Cigna.
going to stop calling out insurance. I ain't trying
I'm
to get
sorry.
sued.
I'm under another.
I meant to tell Dr. Nadelia.
We're going to bleep it out in
Yeah,
post-production.
please, thank
We're
you.
going to bleep it out. But yeah, so it's definitely difficult as someone with a chronic disease to get it a hold of a doctor. So really me, and you were talking about the gentleman with diabetes, you have to keep that. A1C of 13 is like, that's terrible.
That's terrible.
That's like hospital. That's like really, really bad. That's like, I don't know who's walking around.
But he went to the hospital, and that's how he found out that his A1C was 13. And so he needed health care, but he didn't have insurance.
Oh, really? Yeah.
And so that's why he got referred to me from a fellow patient, and that's how it all started.
Oh, yeah, that's the A1C is a lot better. That's good though. But yeah, especially with chronic diseases, and they just make money off of you when it comes to when you have diabetes. Well, we all know diabetes is like the hot cash cow for a lot of insurance companies when it comes to it. So, I mean, you get insulin for like a couple of dollars really, but they want to charge a lot of money for it. So I appreciate this new era of doctors going this other way because insurance companies, they really don't care.
They don't.
They do not care. They don't care at all.
Yeah.
So you see just the conversation. I'm glad we bought you because you was just your ooh made me go, oh, she said something.
13. Like if you guys don't know where 13 is really bad when it comes to like
those are blood sugars in the 300s.
300
can
constant
stroke and stuff like that, right?
Like
stroke,
heart attack.
But if he had a Dr. Not only do you prescribe stuff, but you're trying to tell them how to get off of it.
Right.
Right. So the difference, it doesn't make a difference to you. The person's on a subscription basis. So now you can focus more of your interest on the well-being of the patient. So again, did you see hey, this is definitely probably a better way to go because someone's really invested in my health, or do you stay part of the system and just, be a number?
I mean, no, it's a better way to go about, especially with somebody who's like, okay, let's do a follow-up immediately. Even my other doctor, my endocrinologist, she honestly didn't schedule a follow-up. No, what I did is I went to, because it's like was it Piedmont? No, oh my God, let me not say the name.
Yeah, damn it.
I went to a health clinic.
I went to a health clinic.
A hospital-based health
You could
clinic.
go like, I don't even care if you go, I went to a blue and white hospital on Stockbridge Avenue.
I know that it's, I just remembered it. I'm not going to say it though.
Thank you.
But it's in Midtown. We're going to say that.
Let me ask you, walk through, how long did you wait for your appointment?
So when I got there, are you talking about like when I scheduled it or what's from when I called?
When you walked in that door, how long were you waiting to see the doctor?
Oh, it took about 45 minutes, and I arrived on time. And it was like a literally a McDonald's system. I've never been a part of that because I'm used to more, smaller area Metro Atlanta doctors. But I decided to go to Midtown because I heard this, reputation. But no, I went in. They're like, okay, let's go ahead and check you in. And I was literally in a queue of people getting weighed. Like you were going this.
Doing the vitals.
Doing the vitals. It was a whole like a queue. It was very efficient, I would say. It was very efficient. Didn't have a lot of feel to it. My doctor came in. She was not very nice. I would say didn't have a lot of bedside manner, I will say.
How long did she talk to you for?
I would say literally 15 minutes. And I had a lot of questions because I'm getting older and I have type 1 diabetes. I was like, okay, so what should I look like? I had a lot of questions. Yeah. And it didn't feel like I could have honestly asked them all because she was kind of like, okay, we got to check. So that's why I went there.
Wow.
Yeah.
And then you left, and then did you have a copay or deductible?
Yeah,
So you had to pay that, right?
Yeah.
And then when you left, you had to schedule a follow-up, right? Mm-hmm. Which was maybe 3 months or...
It was 6 months. That's 6 months. Dad said, they said 6 months. I tried to go to that one again. I arrived late, had to schedule it again.
6 more months.
No, it was like 3 more months. But then I rescheduled it for a place closer to where I am now because she goes to different locations.
But anything can happen in 9 months.
No, that's I agree.
It's a long time to wait to see your doctor.
I agree.
So let me walk you through what your experience would have been with me.
Yeah.
Okay. So you would have called my office, you would have paid a membership, and you would not gone through insurance, right?
Right.
But with that membership, you would have made an appointment and you would have been seen the same day or the next day if you really needed to see me. Okay. Right. You would have came in, your wait time would have been 5 minutes, maybe 10 minutes max. Okay. Your waiting room that you saw a shuffle of people, you would be the only one, maybe the second person in that waiting room because you're appointment based and you get seen right away. Okay. Your visit with me would not have been 15 minutes. It would have been 1 hour.
It should be, yeah.
It should be, right?
Yeah.
And you could have asked all the questions about your diabetes. We would have taken your monitor out. We would have looked at all your sugars, what the 7-day, 14-day, 30 days were blood sugars were trending. Would have done your blood work. Your A1C is a $4 test. Your CBC is a $4 test. So your labs, if you want to use insurance, you could, but it would have costed $20.
Yeah.
Okay. You would have came out. You would have said, Dr. Mehta, I still have some questions. I was like, all right, come back next week. Okay. We'll do another hour. You don't pay any copay. You don't pay any deductible. That's $129 flat. Okay. And the medicines that you had to go to the pharmacy for, as long as they were generic, they were available at my office.
Oh, really?
So you would have walked out the door with those medicines in your hand.
Okay.
No pharmacy lines, no, prescription not getting there by the doctor. Let's say you had a blood sugar spike that happened on a Friday night, and then you didn't know what to do. Well, you have my number accessible. So you would have called me and said, doctor, or texted me and said, hey, what do I do here? And we would have hopped on the phone or virtually on a FaceTime and we'd have gone over what to do.
Oh, okay.
Right? So the whole experience is better. But what does that do? That gets a better relationship between you and that doctor.
Right.
You can trust that doctor because that doctor at least knows that you can get in contact with them.
Right.
And that's where healthcare is lacking.
That right there, yeah. I'm not even going into the whole story.
Listen, we just shot a whole commercial, doctor. You owe me for that. You owe me commercial business.
No, but this is a great example.
Yeah.
This is exactly why I did this model. Because patients, I'm not trying to make the patient upset.
Yeah.
I got put in a system that makes me operate the way that doctor she saw has to operate. Yeah. They have to see these patients.
Gotcha.
It was a lot. Yeah, I saw what you said. I noticed it was like a queue, like, okay, and they only had a certain amount of time because literally she went from my office. I heard her go to the next office.
Right.
And
yeah. Oh, you could hear it. And and so what I do is I usually leave my door open. I don't let them close it. I'll be like, I'm still here, motherfucker. Yeah. You know. Yeah. Right. But listen, I got to thank you for that because we're gonna do the whole thing. So usually when we said it, you can sit right there.
Uh-huh.
Usually the way the podcast works is Dr. Anand would actually show somebody how to open up a family practice and we'll leave blueprints. But we could always do an episode of part 2 with you. Sure. But this one was so dope because you literally gave people the blueprint on how to come and to better health by reaching someone like you. Yeah. And so I think that's way more important.
Yes.
You can't start a business unless you're healthy yourself.
And it doesn't have to be me. I mean, look up direct primary care under Google. I mean, there's websites like, the DPCA, which is the board I work for.
will tell you.
They have a map. There's numerous. These practices are all over the country. So it doesn't, wherever you're listening from, find a doctor like me or find healthcare like me that gets you better care overall.
Let's get it. Listen, it is a pleasure to have Dr. Anand here. But this is a part of the show where we talk to you about your business because this is the healthcare, which we count. Sure. And then the CEO part is the business part. So I hope you've thought about what it is in your business, because this is when I put my doctor suit on and I turn into the healthcare CEO. We're going to talk about what we can do to improve whatever you feel like is unhealthy in your business. You ready for that?
Sure.
I'm going to go all in. I got my prescription pad. I'm going to be like, all right, you need this. Viagra for marketing. Viagra for, let's get it. All right. Yep. So we're going to have you sit down. We're going to break it down in like 2 minutes. And Dr. Anand's going to be back and the healthcare CEO will be back. And we're going to get this thing going. Let's go. You ready?
Thank you. I love it.
Let's go. What's going on? We are back. Healthcare CEO podcast with my guy, Dr. Anand, Stand Up Family Medicine. Mm-hmm. If you watch any of my episodes, you know that we take time to not only just let our clients or our guests talk about the great things they're doing, but we want to make sure that we add value to their lives. So, Healthcare CEO here, I'm going to do a full, thorough evaluation of your business. Mm-hmm. So, if there was something in your business that you felt was a little unhealthy, and we're just using the word unhealthy, just to say, hey, what can I improve on?
Yeah.
What would it be?
I would basically say access. I have close to 500 patients now, and we're going to need more help. Unfortunately, my nurse practitioner is leaving, so I need to replace or find a suitable doctor to help me.
You're looking for a doctor, not a nurse.
Yes.
Okay, that's not the problem that you gave me before break.
Sorry. So what did I give you?
You told me you want to grow the business.
I do, which means another doctor. That's what I'm saying.
Gotcha. Okay, so we've tried all the local things like Indeed, Monster, and all that, right?
Yeah, well, this is all new, so I'm just about to start my search.
Okay, and so one of the things I would do is probably look into like group chats with doctors and stuff like that, right?
Absolutely.
Maybe even starting your own. Maybe this podcast will help. And this is the way that any doctor that's looking to get out of, the bedside of the major hospitals, and they're pretty exhausted, but you want more of a person-to-person where you can see the results of the patient. Right. You want to call Dr. Anand. So we're going to diagnose that with this podcast and putting you on other podcasts. Right. I think the best thing that people do right now is to exploit the way that we use phones, right? Yeah. So to get that message out there again is, I think, creating a channel where you are exposed more and we can get this message across. Absolutely. But also using the Goldman Sachs 500 and saying, hey, I'm looking for a doctor in this era. That's a great idea. Right? Yep. Also, we can do LinkedIn. I always tell people, man, if you want to hang out with people, you go Instagram. If you want to work with people, you do LinkedIn. That's right? True. So absolutely. We want to create a campaign, which I actually have a 3-week campaign that I wrote up for you right now. Okay. It's called the Employer Outreach Campaign for your practice, which includes LinkedIn and what did I say, Monster and all that stuff. Yeah. And also creating a social media awareness for you saying, hey, this is what I'm looking for. But we want to make sure that doctor aligns with your culture and your values, right? Not just someone who's burnt out, but still has money in sight. Right. Hey, I thought I was getting paid for this. They know that they're doing a lot of this stuff.
The brand has to have the personality that fits it.
Yeah. And so once we really hone in on what your culture is and how you want to build that culture, then we'll put that culture out there. And I'm pretty sure we will find somebody that will be into the stand-up practice. Can't wait. That sounds like a good enough prescription.
Sounds good.
It came off the top of my head.
That sounds good. I got to tell you, it's different sitting on this side of the table.
Listen, let me take a deep breath for me.
Do you even know how to
use this? Is that a real one?
I was a paramedic. I was a paramedic.
I don't think he knows how to use this.
Look, this shit works.
Don't hurt yourself with this.
Look, you see that? That's reminiscent.
Do not hurt yourself.
But we should take a deep breath. Yeah, he needs another doctor. Good enough. Let's go. This is your boy, Healthcare CEO, episode 16.
I appreciate it, man. Thank you, man. I appreciate it. Yep.
So, right? So, yes, we got everybody coming in. If you guys have any problems getting insurance or you're on a really high deductible plan or whatever, and you feel like what he said resonates with you, worst thing you can do is just give him a call. And it might not be the fit for you, but at least give him a call, right? Have options. In a world that options are very limited now. Right. So now he's giving you another option.
Knowledge is power. You know what I mean? And healthcare is something we need. Info at StandUpDPC. Is StandUpDPC, all one word. .com is how you get in touch with me and my staff. If you have anything, StandUpDPC.com, www.standupdpc.com is my website. And again, just type in direct primary care if you want to know a practice near you or more about what our practice is. Because they're popping up all over the place. And for all the doctors who are looking for a change, listen, the money, obviously, with any business starts off slower and then grows over time. But your life and how you practice and your mentality improves drastically the day you started. So any business is scary, but go into a better opportunity that's better for your life and better for opportunity for your family later in life. And money will grow with you.
And if they get in touch with you, how do they do that?
Info at standupdpc.com and the website standupdpc.com.
And if it's an emergency, please call 911 first.
Absolutely.
Call him. So let's get it, man. I appreciate you, my friend.
I appreciate the time. I appreciate it.
Thank you so much.
Yep.
Let's go.
Thank you all.